Healthcare policy has been a frequent topic of debate over the years and something that many politicians include in their platforms when running for office. New policies created affect not only the amount the citizens must pay for their care, but also how accessible it is and the quality of care provided. A combination of public and private insurances are used by people across the United States, with Medicaid and Medicare being the two major public options. Many Americans are provided with private insurance through their employers or have to find another private company to insure them outside of this. The Affordable Care Act, ACA, was passed by Obama and is often called Obamacare in 2010, which helped to create health insurance exchanges and required all citizens to acquire some type of health insurance. The three main goals of the Affordable Care Act were to reform the private insurance market, expand Medicaid to the working poor, and alter the way that medical decisions are made. I believe that Obamacare has helped America take a step in the right direction to help all people obtain quality health care at an affordable price. According to research done by the Center for American Progress in 2020, 20 million Americans were able to gain access to health insurance coverage no matter their race, ethnicity, or age. The Center for American Progress also found that women were able to have more access to resources such as screenings for breast cancer or genetic abnormalities, and were even able to get a hold of contraceptives like birth control without any out-of-pocket costs. In previous times, those who had pre-existing medical conditions were denied coverage because they had these conditions before they had the insurance. But under the regulations of the Affordable Care Act, this is no longer an issue people with cancer, for example, will have to face. Insurance companies used to be able to set dollar amount limits on the coverage they offered and provided to people, but once the Affordable Care Act was passed, they were no longer legally able to establish these limits. Another benefit of the passage of the Affordable Care Act was the cost reduction of prescription drugs, especially for senior citizens who often have more prescriptions than those who are younger. In 2017, the Centers for Medicare and Medicaid Services released a statistic that Medicare beneficiaries were able to save $26.8 billion on prescription drugs they needed under the policies of the Affordable Care Act. According to the ATCA Scientific Medical Sciences article, the Affordable Care Act provided incentives for hospitals and Medicare plans, such as the Advantage plans, to improve the care they provided while also keeping the cost down to a minimum. While the ACA was known for benefiting the elderly, it also ensured that younger people who are covered under their parents' insurance will continue to be covered until they're 26, while they're getting out of school and establishing themselves before they get their own personal insurance. This was in the ATCA Scientific Medical Sciences article. As with any new law, there are always things that need to be adjusted and reevaluated as time goes on. The Affordable Care Act was a giant step in the right direction when it came to extending health care to all people in the United States while also being affordable to all.